Hello guys, hello. I hope you have had a good day. I hope you're having a good morning. I hope you're having a good evening. It's evening where I am at. I don't know what time it is you will be able to watch us. And also I don't know where you will be watching us from, but today I'm so excited as usual. When I do come here, I'm all excited because I do love sharing. If you're watching us for the first time, I am Florence, and here we talk about life in the diaspora for newbies. And obviously, we cannot talk about life in the diaspora and not talk about work, talk about families, talk about children, talk about everything: growth, success, and excellence. So, guys, a big welcome to you all. Please do tag your friends, do share this live, share with your friends, share in your groups, share with your communities, share, guys, share, because sharing is caring. So guys, today, if you check on the link in the bio that I've actually put in, today I'm going to talk about like my application process for the role of healthcare assistant within the NHS. So for those that will be watching me for the first time, I am a healthcare assistant in the UK, and it's been 2 years that I've been in the country. An exciting journey, an insightful journey. It's been a blessing. It's been quite a journey, and one of the reasons why I do love coming here to share, it's because it's a healing journey for me. And part of my healing process is through sharing with my community, sharing with all of you. I do hope we are inspiring people, we are bringing insight to certain things. So one of the reasons why I thought like, well, I'll come and I'll share to the best of my ability and knowledge about my journey applying for the role of healthcare assistant within the NHS. It's because somebody reached out to me and said, Flo, do you know of anybody that I can actually pay to do the application for me? So I was like, no, this is free. Nobody should be paying for a job application, or should be paying for a job. So that's why I said, well, I'll come and I'll share the process and what I went through applying. So guys, tag your friends, share with your friends, share this link, and a big welcome to you all. And thank you so much for your support. Thank you so much for your love. Thank you so much for all that you do to support us here. We are encouraged by what you do. Your support actually does encourage me. So today I'll be looking at my laptop and quite a lot, and I'll also be looking at my notes, guys. So for those that are joining us today, I'm going to be sharing about what I went through applying for a role within the NHS in the UK. And what inspired today's live is because somebody reached out to me and said, Flo, do you know of anybody that can help me with my application? I'm willing to pay. And that got to me because in this country, it's unlawful for somebody to pay for a job interview or for a job application, or it's not allowed. These things are free. And so that's why I say, well, today I'm going to come here and we're going to have this talk. So the things that are involved if you're going to be applying to the NHS, if you're going to apply for any role, I do love to talk about healthcare assistant roles, because that's what I do. That's my job role. That's what I do. So, but then this does apply whether you're a nurse, whether you're a social worker, whether you're a doctor, whether you are I don't know, whatever that you are. If you're going to be applying to the NHS, the process is the same. The website where you go is the same. What you do, because it's a really long process. So I do hope I should be able to do a series of videos to take you through the whole process, from applying, creating an account, applying, response, getting an interview, attending an interview, and everything. I do hope I should be able to share with you. So guys, what happens if you have to apply? Well, what I did when I applied for a role within the NHS was, first of all, I was seeing a lot of roles on Indeed. I kept on seeing roles on Indeed. So I did go onto the website, and it will direct you to a link or a website called Track. That's what it's called. It's called Track. So when you go on Track, you do open an account with them. So it's like a personal account that you do open. A big welcome to you all. Oh my God, I'm seeing my Amai Cherit Mukora. Good to see you. I love you. Thank you so much for the support. Guys, today we are talking about how to apply for a job role within the NHS. I do talk about the healthcare role because that's what I do, but this can apply whether you're a nurse, doctor, social worker, anything, any role, physiotherapist, radiographer, sonographer, whatever. If you're going to be applying for jobs within the NHS, this is what's involved. So I'm going to explain to the best of my knowledge what I did applying for this role. So what I did is I did open an account with Trek. I shall go back to the comments and type in like the link where you can actually go when we are finished. So but that's what I did. So I had been seeing like job roles on Indeed because I'm registered with Indeed. So if there is any roles or job position within the area that I actually filtered, they do come to my email. So I had been seeing like roles, and well, I thought like, well, let me do this. So I did open an account with a Track. So after doing that, I started now, like I went on NHS jobs, and then I saw a lot of job roles. Guys, one of the things that I do talk about in different platforms or even on my platform is to say like the NHS in this country is the biggest recruiter for healthcare professionals. I don't think there is any organization that has got like as many employees and is currently recruiting. That's why we do love to talk about this. So if you're looking into applying within the NHS, probably you're at the right place, right platform today. So share with your friends, share with anybody that you know that could be interested in this. So I did open my account with Track, and then I started like applying for jobs. One of the things I do love to talk about criteria to say, always look at what suits you. For some, they don't mind moving, they don't mind relocating, but for me, I wanted to stay in the same town where I used to stay. So I had like a perimeter limit to where I was applying or where I would actually apply. So it depends with you as an individual. Do you want to still apply within the area where you are, or you actually want to apply to different trusts? So for me, I had to stick to the trust within the area where I live. So after I created my account, so I would just every day I would just check like, is there any vacancies within the trust? Is there any vacancies that I'm interested in? So vacancies do come up like every other time. So one of the things that you have to check when you see vacancies is always check the closing date, because sometimes in as much as it could have like a closing date, maybe that's maybe far ahead, but depending on the response that they do get, sometimes they do close vacant openings even earlier. So if you're interested in doing that, then time is of essence. So always make sure like you are that early bird and you can catch the fat worm. So that's what I did. After opening my Track account, I started like going on jobs, clicking on jobs, and started applying. Guys, today I'll be looking at my laptop a lot because I want to take you through my application. It's unfortunate, I don't know, because of like data protection laws in this country and things like that, I am not going to be showing my application, so bear with me, but I will try in as much as I can to give adequate information that can actually help somebody. So what the after going into Track, and I would go to a job role that I liked, then I would just click on application. So when you do click on application or apply for this role, there is like the job description, the criteria, everything on there. So for me, I picked definitely like healthcare assistant job role. So like there'll be also, this is a very transparent system. This is a very transparent, I don't know, employment system. So you don't have to pay anybody. You don't have to know anybody. It's irrelevant. It has got no bearing to you getting the job or not getting it. So you don't need somebody to refer you. You don't need to pay anybody for this. So that's what I did. So I got into the application, read the job description, read the criteria that they wanted, and obviously I had been a healthcare assistant in the country for 18 months by the time I applied for this job role. So I mean, I thought, well, I fitted the criteria. So it's always important to read the job description. You don't want to waste people's time. You don't want to waste your own time when you know definitely you don't fit the criteria. So it's very, very important for you to go through that job description. And that way, again, it will also help you when you get into your supporting statement, which is one of the things that we're going to talk about further into this conversation. So do stay tuned, guys. Share this link, share the link to this live, share with your friends, share with your community. So I did get into that. So you do log into your track, go on to the job role that you want to apply for, click apply. So there will be questions, straightforward questions that you just have to answer. So there is the first section on there when you start applying is the it will tell you the job reference, closing date, application submission date. Well, it will come up when you do submit. Then each and every application that gets done, it has got an application ID. That goes on to show you how transparent, how straightforward this is, and how nobody can actually influence the outcome or influence your ability to get a job role or not to get it. So it's very straightforward, and it's a tried and tested thing. So each and every application that you will make will have an application ID. So that's straightforward. So the first section it has got, the first section that you fill in is your personal details section. So it goes on to say answers given in this part of the form are to help the recruitment center to manage your application. If you have any difficulty completing this form, please ask somebody to help you. We would like to take this opportunity to thank you for applying. So it's actually allowed for you to ask for help, but guys, do not pay anybody for that help. These things are meant to be free. But it does say, if you have any difficulty completing this form, please ask somebody to help you. So, but I'm somebody that does not believe in paying for recruitment, paying for anything to do with recruitment. I do not believe in paying. I don't know. That's just me. So you do fill in your personal details. That's your name, your address, the country you're applying from, things like that. You put in your telephone number, be it your work. You put in your email address as well. If you, I don't know if you're applying from abroad, but I applied from here, so I switched to the NHS. So they asked for like my national insurance number, things like that. One of the things that they ask you is they do ask you your preferred employment type. So there's part-time, there's full-time, there's flexi-time, there's a lot of options within the NHS. So you do pick what works for you. So guys, I don't know if you watched one of the videos that I did put out where I said, like, you don't necessarily need to leave the organization you are in for you to gain experience elsewhere. So you could be loving what you're doing. You love being in domiciliary care. It's lovely there. You enjoy it. You don't have to leave your domiciliary care. You can actually join organizations like the NHS on a part-time basis. Like I said when I started this video, like, the NHS is the biggest recruiter of healthcare professionals in this country. I don't know if anybody's got a different statistics or different figures. You are free to put it in the comments, but it is the biggest employment agency for healthcare staff. So you can actually join the NHS on a part-time basis. You can join on a full-time basis. I know from experience, I know from interacting with people, there are people that do work part-time and they do a brilliant job. So you can actually join them on a part-time basis because you love what you do. You love your support work role, you love your live-in role, you love your domiciliary role. You don't have to leave that job to join the NHS. You can actually still be employed by your employer and work for the NHS on a part-time basis. But if you do want to work on a full-time basis, you do have to fill in on the first part of the application segment where they do ask you these questions. So for those that are joining us, I am taking you through what I did when I was applying for the role within the NHS. So we are actually going through my application and what I did. So stay tuned and share with your friends as well. And a big shout out to you. And thank you so much for always supporting. Thank you so much for the love and more. We do love you. So the second part, they will ask you about your relationships. So the question says, if you are related to a director or have a relationship with a director or employee of an appointing organization, please state the relationship. So I say this, I think in a live that I did yesterday, where I spoke about professionalism and things like that, accountability, things like that. So they do ask you if you are related, close relationship with anybody that has got an influence within. You do have to step that. It's a requirement, so you do that, and it doesn't take away. It will not mean you will not be employed. It does not mean like you will be prejudiced in any way, but I think it's for accountability purposes anyway. So you do that, so you fill in depending on your circumstances, depending on your relationships. So there is a section where they will ask you about Rehabilitation of Offenders Act of 1974 exceptions, order 1975 amendment. So this is about convictions and things like that. So it's a question, it's a long read that you will definitely have to go through. It's about like disclosure and barring services under the Rehabilitation of Offenders Act. If you are in care, of if you are wanting to join care, you definitely know that if you have been convicted of certain crimes, or if you've a criminal record in certain areas, you do have to disclose, because there are certain crimes, if you're convicted of them, then you cannot work in certain roles, you cannot work in certain care settings. So it's important for you to declare that anyway, because whether you declare them or not, still they will take you through the DBS process and they will find out anyway. So it's actually good if you do declare. I don't know what happens if you declare a conviction. I do not know what happens then, you know. So there is a section where they say fair recruitment process. I'll read this one because I love fair recruitment. A big shout out to these organizations that emphasize on fairness, accountability, and professionalism. So it says such and such trust aims to promote equality of opportunity and is committed to treating all applicants equally and fairly based on their skills, experience, and ability to fulfill the duties of the role being applied for. So guys, we are talking about equality, we are talking about fairness. So do not look at yourself and already disqualify yourself and say, well, I'm from such a background or I'm from such a country. Just apply, because one of the policies within these trusts is for fairness and equality based on your skills. So employment is based on skills, experience, and the ability to fulfill a role and nothing else. So where you come from, your background has got no bearing to employment. You do not get prejudiced because of where you come from. So guys, these are some of the things that we should go for if you really do feel the NHS is for you. So actually they go on to say suitable applicants will not be refused positions because of criminal record information of other information declared where it has no bearing on the role. So guys, you could be having a conviction, but if it has got no direct bearing to the role you're applying for, you could be employed even if you do have a conviction. This is what the trust I work for says. So I don't know about any other trust, guys. I'm not here to spread falsehood or to I don't know. I'm just reading what's here. So they go on to say this part of your application will only be viewed by those who need to see it as part of the recruitment process. So it's not like if you declare your conviction, it will be like published to everybody. No. And part of one of the things that these organizations are big on is confidentiality. So that's why I think they had to go on to say, go on and apply freely. Because the information that you put in your application is not like it will be shared with everybody. No. So they do protect your identity. They do protect you as a person. They do protect information about you. They're very good at that. So they say your information will be treated confidentially and will not be shared. So that's an assurance. So go on, guys. If you do feel this is for you, go on and apply. So there is a long list and there's a lot of links on information to be declared. So they go on to say, what information should I disclose? So I'll just quickly read this. They say understanding what offenses might need to be declared to a prospective employer will be critical to ensure you do not disclose information you are not legally bound to declare or omit relevant information that must be declared. Guys, I always love to say this, to say as newbies, there are things maybe based on where we come from or based on our backgrounds and things, sometimes we feel the need to say certain things. Guys, it's actually important in these countries for you to know what you can share, what you're required by law to share, and what you're not obliged to share. And so there is a few links on the application, if you go on to apply, there's links on what you should. They say if you're unsure about whether you need to disclose certain criminal record information, free confidential advice may be sought from one of the charity bodies listed. So there is guidance on rehabilitation from the gov.uk. That's number one. There is what they call NACRO. There is what they call Unlock. So if you do have a conviction, go on to this website and do ask if you really have to declare it in the event that you're looking for employment. So there are things really, things to do with convictions, things to do with your health, things to do with I'm trying to think some of the things that you're not really obliged to. I do remember at some point, you know, guys, our background, sometimes it does let us down. You know, we come from those backgrounds where sometimes people invade our privacy. People do ask like questions that they shouldn't even be asking. And it's one of the things that I'm actually learning in this country, that like, it's not everywhere that you need to disclose anything to do with your health status. It's not every time that you have to like even disclose to your manager or to your organization. If you have been maybe to the hospital, you don't have to tell them what you are suffering from. You don't have to tell them your condition. So it's one of the things that I'm actually learning on the job. So I've just thought I would say this because there are people that constantly come to my inbox and say, I do have a certain condition. Is that a barrier to employment or to moving abroad? I do hope I'll get the time and I'll do a video on it to say, really, when you're applying, especially in the UK, I do love talking about the UK because that's what I know, because I'm in the UK. I moved from Zimbabwe to the UK, and one of the things that I discovered along the way is we were not asked any health questions. Yes, we had to produce a police clearance, an equivalent of a DBS, where they do check your criminal record, but that's the only thing. The only health condition that they were worried about was like TB, tuberculosis, which whether you have it or you don't have it, if you do not have it, they give you a certificate to clear you, and then you go on to apply your visa. If you do have it, they give you treatment, and then you have to wait for 6 months. Hoping, fingers crossed, you are clear by that time. So those are the two things that you are asked. Those are the two things really that I was asked. So just be aware that do not prejudice yourself when you're applying to this organization based on condition, health condition, or criminal conviction. Find knowledge. Be open about your conviction. It might not have a bearing on your application. So guys, I'll quickly go on. So it's a conviction question. If you have any convictions or anything, then you answer yes or no. When you do answer yes, then they'll go on to ask you to explain in detail the nature of your conviction. So it's important to be very honest when you're answering these questions, because you do not want things to come up later on. Then there is the next section is the pre-screening or internal or external screening. So it says, before being given access to the online application form, the application was asked the following: are you currently an employee of such and such trust? So you answer yes or no, but then this has got no bearing on you getting the job or you not getting it. Why do I say that? Because, well, when I did this application, I was applying as an internal. I answered yes. Why? Because I had joined the bank team. So I was part of the NHS bank team. So yes, I was part of, the company, the organization. But then when I did apply for the bank position, I was just coming from outside. It wasn't an internal one. So whether or not it's an internal application or external, it has got no bearing on you getting the job or not getting it. I mean, if you do remember when we read at the top, they said employment is based on your abilities, your skills, and they spoke about skills, ability. Let me go back because this is very important. They said skills, experience, and ability to fulfill the role. 3 things. So whether internal or external, for as long as you're experienced enough, for as long as you have the skills, the qualifications, and you can actually fulfill the role, then definitely, the job is for you. So I'll not spend much time on that one. So then they'll go on to ask your pre-screening immigration questions. So they say, before being given access to the online question, I'm sure this is for everybody, whether you're, it's a generic application form. So it says choose your immigration status. So I choose, and I said I have a skilled worker visa that was sponsored for me by my current employer. This was, guys, for those that are joining me, this was how I applied for my switch from the company I used to work to join the NHS. We are just taking everybody through what I went through, and this has been prompted by one person who actually inboxed me and said, Flo, I'm looking for somebody that I can pay to help me with an application. And what stood out for me was the fact that nobody should be paying for a job application. Nobody should be paying for a job role. A big welcome to Elaine. I do love you, and thank you so much for watching. I'm so humbled. Thank you so much for the love and more. Today we're talking about the process that I followed when I was applying for a job role within the NHS. And this has been prompted by one person who actually reached to me and said, Flo, can you help me with somebody that I can pay to help me with an application for an NHS role? Guys, this really got to me, because in this country, it's not allowed, it's illegal. Nobody should pay for these things. It's free. It's your experience, your ability, and your skills. Then that's it. So that's why we are going through my application and what I did. So for those that are joining us, I said one of the things you need to do is you open a track account where you open a track account, then you click on the job that you're applying for, and then you go straight into the application, which is what we are doing. There will be like questions, simple questions that you have to answer truthfully, honestly, to the best of your abilities. So we were on pre-screening immigration questions where they asked like what your immigration status is. So I answered truthfully and said I had a skilled worker visa which was sponsored to me by my current employer. So they said if you wish to provide any additional information regarding your right to work or immigration status, do so here. So I did put extra information there, which of course for reasons I will not be sharing with all of you. So this will go on to the actual application questions. So these were just like pre-screening questions. So we go on to the application questions in detail. So it says details entered in this part of the form will be made available to the shortlisting panel. So I spoke earlier to say answer truthfully, answer honestly. Why? Because I mean, anyway, that information is not, will not be shared with anybody that is not involved in the recruitment process. So it's not like it will be published or anything. So you have to just answer truthfully, like somebody who wants the role. So please make sure you have read the job description and the person specification before completing the application form, and ensure that your answers clearly and honestly demonstrate how your skills and experience are relevant to the post. I've said it before to say, one of the most important things that you need to do is read the job description, read the person specification, or read the employment criteria. Who are they looking for? Do you fit that criteria? Why? Because within the NHS, there is what they call the supporting statement, which we'll go into detail later on. It's important for you to read the job description, because in the supporting statement, you are actually telling them how you do fit within that role. So it's quite important for you to, and they've actually emphasized it to say, before answering here, make sure you've read the job description and the person specification. So it will save you time, it will save everybody else time when you do that. So after that, there is like the education and professional qualification sector. So it says all the relevant qualifications. Please also indicate subjects currently being studied. All qualifications disclosed will be subject to a satisfactory check. Up to 11 qualifications can be entered here. So guys, it's important for you to list your qualifications, and just take note, guys, you are allowed to list 11 qualifications. So this is what I did, because I'm from abroad. I'm from Zimbabwe. So I did list, I have got ordinary level. So they'll ask you which subject or qualification, place of study, the grade or result, and the year obtained. So I listed my ordinary level. I listed the school that I went to, and obviously I listed that I passed because I passed, and the year in which I sat for my exam. Why do I want to emphasize this? Is a lot of people do leave that out and say, well, it's not relevant. Why I felt it was relevant in my cases, because other than that, I do not have a degree in anything. I do not have a diploma in anything that is relevant to this role. A big shout out to you. Heather Adams is in the comment section. Thank you so much for watching. Thank you so much for always supporting. Guys, today we are talking about applying within the NHS as an HCA, as a doctor, nurse, or whatever. But I do love talking about HCA because that's what I do, and that's how I joined the NHS. And I've said it before to say, it does not necessarily mean you need to leave your organization for you to join the NHS. It has got part-time jobs, flexible working, full-time roles. So if you do love what you're doing, if you're happy in your organization, but you feel you want a different experience altogether, you can actually join the NHS on a part-time basis. So we are talking about the application process, what I did within my role. So I did, because I didn't have any prior qualification or degree or diploma or certification, so I felt a need to put in my ordinary level where I studied in my grades. One of the things that I put in was, I love talking about this because I did my Red Cross training in Zimbabwe. So my Red Cross training consisted of 3 certifications, which was community-based healthcare certificate in Zimbabwe, and I listed the year in which I took that certification. I did the Advanced First Aid Red Cross Zimbabwe. I put it in. I did the Nurse Aid certificate with Red Cross, and I put it in the year in which I did that. I also went on to state that I had done my care certificate with that company that brought me to the country. A big shout out to them. I'm so grateful to them. And I do love to say this because I do encourage people to take seriously internal training, because you just never know where it will take you. Look at this. I did my care certificate right on time. I finished it, and I did it so well, and it got me somewhere. So guys, take seriously that care certificate that you're being offered. I'm talking to people in the UK, and I'm also talking about people that are abroad. Abroad, I did my Red Cross certificate, 3 stages: Nurse Aid, Basic First Aid, Advanced First Aid, and Community-Based Healthcare certificate, and look where it got me. I did my care certificate, 15 standards of care, with the organization that brought me, while I was still doing my domiciliary care. So it's no excuse for you to say, I'm doing domiciliary care, I can't do it. I did my care certificate when I was still doing domiciliary. So guys, take internal training seriously. So I did put that in. So those were the qualifications that I put in for this job role. No degree, nothing. So I know you could be in that situation where you're saying, I do not have a degree, I do not have a nursing background, but I do want to join the NHS. There it is. I just put in my ordinary level, which is an equivalent of, like, I think GCSE. I put in the Red Cross training that I did when I was back home in Africa. I put in my care certificate, and that was all. A big welcome to Rumbi. Rumbi, thank you so much for joining, and thank you so much for supporting. I'll go on where they say the relevant training courses that you attended. So guys, I do love to talk about internal training. I do love talking about it because, I mean, it got me somewhere. So I do love to share. I do share all the things that got me where I am. I do love to share with you. So I listed quite a few. Guys, when you are doing this application, make sure you put in the work, you are patient, and you put it your all. So it says, please provide details regarding training courses that you've attended or currently are undertaking, together with the date completed or to be completed by. Up to 7 training courses can be entered here. So guys, I'm just letting you in on, be wise when when you're picking, because we do get trained on a lot of things. But then if they do say pick 7, definitely pick those that will like speak to whoever is going to read your application. Or I don't know, some people will say the ATS application does the picking. So definitely put in what works. So this is what I did. So I put in to say I'd done a care certificate, and they say put in the course title, the training provider, duration, and the year completed. Guys, I want to emphasize on this one, and I want to show you something. So I did my care certificate. This was an online training with a provider that's called Programming UK, and this had a duration of 3 days, right? 3 days training course. It was online. Guys, I want to to show you how powerful and how powerful these courses are. You may say, well, it's not a degree, it's an online course. Do it. It's very powerful. It can get you somewhere, because it did take me somewhere. I hope the grammar is correct. So I put in care certificate that I done online. Remember, I put in the care certificate on top that I did with my company. I think it took me about like 3 months to do. I don't know, depending on how fast you are on, and depending on how your training manager, is on, on your case. So 3 to 6 months care certificate usually done. So I did another one online for 3 days. I done a training on medication administration. It was a 1-day course. I did food theft, 1-day course. I did a dementia awareness course, 1 day. I did basic first aid. It's a 1-day course. Safeguarding of vulnerable adults, 1-day course. Infection control, 1-day course. Health and safety, 1-day course. Mental health in the workplace, 1-day course. Mental Capacity Act, 1-day course. Equality Act, 1-day course. General Data Protection Regulations, 1-day course. So, and I did not leave out that care certificate I did with the company that employed me, that brought me from Africa. I put them in care certificate, 15 standards of care, and I put in my provider. Why I do love to share explicitly like this is to encourage you to take seriously that online training, and to always be proud of that online training, and to do it to your best of your abilities, because you just never know where it can get you. Look where it got me. I didn't have any diploma. I didn't have any NVQ whatsoever. That online training got me where I am. So a big shout out to those that managed to do their NVQ. It will still get you where you are. It will be able, you put it in that section. I mean, big shout out to you, those that are doing it. But for me, I didn't do any of those. I didn't have any diploma or anything. But look, it got me somewhere. It got me where I am today. A very big welcome to Helen. She's in the building. I do love you, and thank you so much for always supporting. Thank you so much for always being there. Today we're talking about what I did to end up working for the NHS as a healthcare assistant. Guys, I love talking about this because I always say I found a new love in care. I do love what I do. I do enjoy it, and I know there is a lot of people out there who may not know what life is like as a carer, or how work is like as a carer. I'm here to enlighten it for you, to say this is a very rewarding job opportunity. You can actually work in care and enjoy it and live a fulfilling life. So that's why we do love to share this journey. But today we are talking about the application process within the NHS, and mind you, this is for free. Nobody should be paying for these things. That's why we decided to do this live. And guys, I'll be looking a lot on my laptop because I'm actually going through my own personal application, the one that got me this role. So that's it. Those are some of the courses that I put in. I mean, I did a lot of courses. So depending on the job role, there is a lot of like different specialties that you can actually join within the NHS and work as a healthcare. So depending on where you're applying, I was applying on like an adult, I don't know, ward, so community ward. So I mean, I picked the courses that I felt were essential amongst like the several that I do. So one of the things that I want to emphasize is constantly be on top of your internal training, and make sure you do print or save your certification, because sometimes you may be asked to produce evidence of that training. You don't want to say I did infection control and then they ask you to produce a certificate and then you fumble about. So make sure you're up to date with your training. And one of the things for those that are joining us, these were 1-day training, 3-day training that got me where I am. So it's quite important and they're very powerful. So please do take them seriously. So I'll move on to the next phase where they do ask you about like membership of professional bodies. One of the things that I've mentioned in this video was to say this process I think applies for any job role within the NHS. So you could be a doctor, you could be a nurse, you could be a social worker, radiographer, sonographer, occupational therapist, speech therapist, whatever. The process is the same. You just fill in what's relevant to your role. So they do ask like membership of professional bodies. So they say, please provide details regarding any relevant professional registration or membership. This information will be subject to satisfactory check. So guys, these organizations are thorough. Whatever that you put in there, they can actually check it. So make sure what you put there is truthful, is an honest answer to your question. Be honest, be honest. We cannot talk about anything without talking about honesty, accountability, and professionalism in this job. So a big welcome to Tabeth, a big welcome to Nyasha, NG, Tandiwedure. Thank you so much for supporting, guys. Leave any questions or any suggestions, leave them in the comments, and I'll come back and I'll answer them. I'll also put in the links. Once I'm finished here, I'll put in the links in the comment section. So do share and do go back as well if you feel the need to go on the links, because I'll put them in the comments. So they do ask like membership of any professional bodies. Guys, I do love to say, guys, I didn't go to uni, I do not have a degree or anything, so I'm not a member of anybody. So I just answered not applicable. So not being a member of that board or anything does not stop you from being eligible for that job or getting that job also. It didn't take away anything. So because I had answered like I did work for the organization, so they asked me when I started and what job role I was in. So I answered that. So I'll not go into detail of that, but I was working for them on a bank capacity, so I put in that. So normally what they do is they do ask you the reasons why you're leaving an organization. Guys, this one, answer it truthfully and answer it professionally. I do emphasize on professionalism and honesty because it does go a long way. So this is how I answered. I did answer. I said, I'm not leaving my current employment as a bank care assistant. However, it is my desire to join the trust on a permanent basis so as to fully contribute to the institution and experience growth and potential as part of the team. Guys, how beautiful is that? If you do think I did well, please give me a thumbs up, give me love and likes. I'll read it again so that if you give me an honest review. If I did well, give me a thumbs up. I said, I'm not leaving my current employment as a bank care assistant. However, it is my desire to join the NHS so and so trust on a permanent basis so as to fully contribute to the institution and experience growth and potential as part of a team. I do love growth. So they went on to ask me brief description of your duties and responsibilities. Guys, always put thought into it. I'm not saying I'm the best, but I'm sharing with you what I put in. So put into the best of your ability, put in what you feel could get you far. So this is what I wrote. Briefly, I said, because they do say you need to like write 500 words on that one. So I said, part of my duties were ensuring patient comfort in line with their care plans and hospital procedures and policies, help with mobility around the wards and between different departments if required, assisting with personal care, continence care, oral care, e.g. washes, bath, getting dressed, etc. in a dignified manner, basic observations and records update in line with the organization policies and procedures, keeping the wards clean and also ensuring equipment is clean and compliant at all times, serving meals and assisting with feeding if required. Guys, one of the things that I want to emphasize when you are explaining your responsibility and duties, guys, keep it very simple and to the point. No need for big words, big jargon and things like that. Keep it very, very simple and to the point. Why I do love saying that is because part of what we do, part of one of the things that is emphasized in these roles is when you are explaining or when you're talking about things, make it understandable to everybody. There's no need for jargon. There's no need for big words. Just keep it very, very simple. Very, very simple. Very simple. That's how I did it, and it got me the job. So keep it simple, keep it straightforward, and keep it very relevant. So I did touch on personal care. I did also touch on privacy and confidentiality when I said in a dignified manner. I touched on the importance of having skills where I said basic observation and records update. Guys, you cannot talk about care and not talk about records. So in your answer, be tactical enough to factor in certain basic things, and those should be coming from, I think, the 15 standards of care should guide you. So if you're going to be applying, I'm not really wanting to say like go and copy what I did, but you should be guided in the sense that, like, make sure you factor in the 15 standards of care. And one of the things that I actually was sharing with somebody when they asked me, like, how did you approach it? I always approach it to say, always check the values of the trust that you're joining. Also, it's important for you to go on to read the values, the NHS values, the NHS as a whole. Go and read their values and then extract from there what you feel is relevant to you, what you feel speaks to you, and then you factor it in your own words. We're not saying go and copy and then you paste it in your application. So it's just one of the few tips that I find to work. Keep it simple. Keep it centered on the job specification. Also, make sure it's speaking to the values of the trust which you're applying to. Always make sure as well that you factor in how all of your answers are linked to the NHS values as a whole. It could get you far. Guys, a big welcome to you all, and thank you so much for watching. Thank you so much for supporting. We do love you. We do appreciate you. So on this section, I was listing everybody that I've worked for. So I went on to list the company that brought me from Zimbabwe. Guys, I cannot talk about my journey and not talk about them. I do appreciate them. A big shout out to them. Beautiful employers, lovely experience, and they gave me the life that I have today. They gave me a stepping stone, and I do appreciate them. And I do wish them well in all that they do. I do wish them all the success. And it's from down there. So I did go on to answer. They will ask you the employer's name. Most people do ask me, like, Flo, my employer, this and that. Just be honest. Most employers are lovely. Most employers are professional. They support you. They support your vision. They support your vision. So do not be shy from mentioning them, talking about them. So I did list out in my employer, their address, the type of business that they do, who you were reporting to, their phone number, your job title there, when you started. So they did ask, like, for the end date, but because I was still employed with them, I didn't fill that in. They ask you for your salary threshold. They do ask you for the period of notice you are supposed to hand in with them. So guys, answer this truthfully. And like I said, everything that they ask you here, they can actually verify. They can actually phone them. They can email them. They can visit them to ask about you. So this goes on to say, guys, all that we do where we work, guys, let's make sure we are working professionally. We are working to the best of our abilities. We do work hard. We do everything, so that you just never know who will go to employer and ask about you. So let's always strive for professionalism, excellence in what we do. It will take us far. So that was me. I listed everything about the employer that I was working for. Then they did ask me the reasons for leaving. So I don't know, but I will say what I said. I said I am currently employed by this employer. However, I'm looking for a permanent job in a different work setting to improve and build on my experience and knowledge in health and social care through working in a different work environment. Guys, I've said it time and again. I did love it when I was working in domiciliary care. I do miss it sometimes, to be honest. So I did have a good experience when I was working there. But then I answered it honestly. One of the reasons why I was leaving, one of the reasons why I would go for this opportunity was the fact that I was looking for growth. I was looking for growth. I've said this time and again to say, I'm looking for growth in terms of academia, things like that. So that's my wish. Whether or not that will come true, we will continue talking about it, and you will find out as you journey with us. And a big shout out to you, and thank you so much for your support and love. So I went on to write. So they said, again, a brief description of your duties and responsibilities. Guys, it's very important. Know what you do. Know your job role where you're working. It's important, and it can come in handy anytime. So I did put in, guys, I want to emphasize on simplicity, keeping it simple. So this is how I wrote. I wrote to say assisting with personal care, including washing, oral care, incontinence care, catheter care, dressing and grooming, while maintaining patient's dignity and privacy. Guys, do not, I'm sorry, but I'll use this word, do not be lazy when you're filling in these things. I wrote about, like, assisting with personal care, but I didn't just stop there. I went on to break it down. That way it shows you know what you're doing, you know your role, you know what is involved. And I did say washing, oral care, incontinence care, catheter care, dressing and grooming, wildness, maintaining patient's dignity and privacy. I spoke about it earlier to say when you are answering questions, always factor in those 15 standards of care. Find something that you can pick from there and you factor it in your answer. This goes on even when you're answering questions in your interview. Always factor in. I'm talking about 15 standards of care because I'm a carer, I'm a healthcare assistant, and I do love care. So depending on what job you're applying for or depending on what interview you're going to, always factor in the certain basic guidelines within that profession or within that role. So for me, it's factoring in the 15 standards of care and look at how I factored in while maintaining patient's dignity and privacy. I've already mentioned to say I'm very professional. I know what I'm supposed to do. If I'm doing anything that is personal, it has to be in a dignified manner. I have to make sure privacy is maintained all the time. I have to make sure I'm doing it in a respectful manner. And I mean, when you talk about privacy and dignity, that's respect. So I don't know. I'm not saying this is the best, but that's how I did it, guys. Leave the comments in there. I'll read them, and I do love it when you do interact, guys. So I went on to say providing companionship through discussions and active listening, and also to help with social activities such as games and sometimes taking walks so as to promote independence. I was just breaking down what we used to do in domiciliary care. Great experience there that I loved. So for those of you that would like to know what we used to do when I was in domiciliary care, this is a bit of like an insight into it. I hope I'll be able to do a video on it. So it says meal preparation and help with feeding if needed so as to ensure a balanced diet and hydration. Guys, this is very simple. Yes, we do feed people. We do assist with food in domiciliary. Yes, that's what we were doing. But what's the end goal? What's the goal for that? Is to assist with balanced diet and hydration. Now you've touched on nutrition. It's there within the 15 standard of care. Nutrition is one of the things that are important. So you're factoring in what you learned into your answers. I mean, I think I did justice to this. I'm not blowing my own vuvuzela or my own trumpet, but that's what I did, and it worked anyway. So you could come up with your own way of answering or your own way of factoring in what you learned, and it could work for you. If you feel you need to add something, just put it in the comments and somebody may learn from it. A big shout out to my Tete, she's in the comments. Guys, you see why I love this platform. My Tete is in the comments. A big shout out to you. I love you and thank you so much for the love, for the support. I mean, I wouldn't be doing what I do had it not been for you. You're a big influence into my life, into my journey, and I love you for that. So I went on to answer and said basic observations including temperature taking, blood pressure checks, weight, and any abnormalities and changes to patients, and reporting them to the supervisor. Guys, these are some of the things that we used to do in domiciliary. So I don't know about where you do work, but there's nothing that can stop you from actually learning these skills. These are clinical skills where you actually do blood pressure taking, temperature taking, and it's important. While you're in your organization, ask if your organization offer that internal training. If it doesn't, also it's important for you to go somewhere where you get offered that training. You never know when it can come in handy. So a big shout out to people that are actually proactive like that and that go for training, because it does work. So one of the answers where I said like we do housework such as laundry, dishwashing, and cooking. That's what we do in domiciliary. So I wasn't shy to mention the things that we do. Keeping it simple, keeping it real. Like we do laundry, we do house chores. So I did put it. It doesn't matter whether I was applying to the NHS, where probably somebody would think like it's a hospital, they've got people for that. But I did mention it, and it did work. And for your own information, regardless of where you work, there are certain basic things that you do, regardless of where you are. So I did mention it. One of the things that I went on to say, because they said describe your responsibilities. I said documenting any observations, tasks, and checks in accordance with the organization policies and procedures. Guys, I said when you answer these questions, I didn't just say like documenting observations or tasks. I went on to say you document in line with the policies and procedures of your organization. Why I did choose to, I was very intentional with that. I was very choosy with that. Why I chose to say that is because you're applying to an organization. What the organization wants from you is they want somebody that will be able to respect, to work within their policies. So when you do say I document with regards to the policies, with regard to the procedures of the company, they do realize like there's something about this person. They do actually realize like you could work for 5 organizations and they all have got their different policies and procedures. So what you used to do in Dormicilliary could be different to what you're doing for this organization that you work for. What I used to do in Zimbabwe will be different for what I do here. So one of the key qualities, I mean, maybe you could be asked like, what are your strengths? The ability to follow organizational policies and procedures is a very, very, very good strength or quality that you can actually talk about if when you are asked. So I do love to mention it, to say I'm good at following procedures and policies. So I went on to mention another employer that I worked for. I will not go through what I, because the process is the same. You will still describe the roles, right? So on that one, I would say keep it simple and keep it detailed. Where you can, keep it detailed, and also always link it to the 15 steps of care. All the things that you learned in those, link it to your answers. It goes a long way and it's quite handy. So they will ask you reasons for leaving, so you just have to answer honestly. So I did put in a few companies. There is an option for, I don't know, I think up to about 5-6 companies, but for me, I put in a company that I worked for when I was in Zimbabwe, the company that brought me to the UK, the agencies that I worked for, and yeah, I think I put in like 3 or 4. So that's what I put in. Oh, my tete is just telling me that my niece is watching. Thank you so much. Thank you so much, Miss Tanya. Guys, one of the things, I'll give my family a big shout out to them, because they do influence some of the things that I do. Some of the information, part of my growth has been influenced by my family, and I love them. They've got like amazing experience because they've been in the UK for the longest, 20-something years, and we do have that honest relationship where they influence what I do, influence the decisions that I do. So without losing myself, they do respect my choices and everything, but they do guide me in a lot of ways, in a big way, and I've learned a lot and I've grown a lot. So a big shout out to them, and I do hope I will one day be able to bring Miss Tanya, that's my niece, and I think she will be graduating. So I would love to bring her so that she can share her journey here, because I'll just give you a quick background on them, because I do love them. They don't come here quite often, so I'm excited. So Miss Tanya, I do hope I'll be able to bring her on here. Why? Because she studied in South Africa. She started studying in South Africa, and then she moved to the UK before she finished studying in the UK. So I would love to share with you how it is like to do a degree first in Africa, and then you come here, and then you go on again to pursue, you know, your studies, how that is like, and an insight into what studying in the UK is if you're an immigrant, things like that. So we will go in detail when I do bring Miss Tanya on here. So I'm looking forward to it. I love you, Tanya. I love you, and I hope to see you soon. Thank you so much, Tete, for bringing her. So guys, we are talking about how I applied for the job in the NHS. So I'm just going through my application. So if you see me looking on my computer, it's because I'm actually reading my actual application as it is. So I'm giving it to you, and yeah, it's unfortunate I can't show you the screen because of data protection laws in this country. I do not want to end up on the wrong side of the law, but I will keep researching and asking if it's allowed. Honestly, I would love to like show people as it is, and what has influenced today's discussion is based on one person who reached out to me and said, Flo, can you actually help me or find me someone that can help me with my application for the NHS, and I'm willing to pay. And that really got to me, because I do believe these things are for free, and it's illegal for you to ask somebody to pay for these services. It's free, it's on there, it's simple and straightforward. But then it also says you can actually ask for help to apply. So ask for help, but do not be paying for it. So guys, I'll be quick. So I'll go on enough about like people that you'd have worked for, employers and things like that. They goes on to say gaps in employment. Guys, this is very important. I've come across this in almost nearly every other application that I've done on this journey. They do ask for employment gaps. So for me, they asked if I had any employment gaps in history. Please state the reasons. So I didn't have any, because when I was answering that one where they say educational, I mean, I've put in the details of when I was born and things like that. And one of the things I put in was to say ordinary level. So they know pretty well ordinary level is an equivalent of like your GSCE, depending on where you're studying from or which country you study in. So already that can show, like, straight away from high school, you started like studying and then working. So I did not have any employment gaps, so I just answered NA. But if you do have them, put them in, and they'll ask you the reason why you had that gap. Reasons could be as far as like having children, starting a family, looking after family, travel. There's a lot that you can put, volunteering, and all those things are acceptable, because there's always something that you learn when you do travel. Why I do say that, I've noticed like here in this country, the English, they do travel. So these people understand that people can go traveling for a year, to leave everything, leave work, leave school, to go traveling for a year or for 2 years. So they do understand there are people that have got gaps in employment because they were traveling. People actually leave work, leave education and everything to say, I'm concentrating on having my children. So it's allowed, put that in. People actually leave work, leave school to say, I'm looking after a relative that's not well, or a family member who is not well. They can leave work for a year or anything. Put that in, because that can actually contribute to you as a whole, your qualities, your skills, and even that, your abilities to contribute in that role. So do not be shy to put that in, to say, I had to stop working in this period because I was looking after a relative who was unwell. I had to stop working or stop going to school because I was traveling. They do understand. And that's why, one of the reasons why I would want to bring Miss Tanya in one of these fine days, for her to fill us in on her journey and things, because she's been through all these things that we're talking about, and we will bring an insight into it. I do love you, and thank you so much for supporting. Guys, if I'm making sense, please leave the thumbs up button, the loves, the likes, and things like that. I do love seeing them. So if I'm making sense, put those in. I do love seeing them. Guys, this is the most important part. That's where we are going, where it says supporting information or supporting statement. A lot of guys, a big shout out to Portia Mgorogodi. Thank you so much for watching. Thank you so much for supporting. You do support me in a big way, and thank you so much. So guys, I'm going to talk about like my supporting statement on this one. Guys, it says supporting information fields marked with are mandatory. So you cannot log out or move out of this application without filling this in. So it's mandatory. So they say in this section, you need to demonstrate that you have read the published person specification and how you meet the essential and where relevant desirable criteria for this particular post, if this has not been fully covered in the previous section. Guys, I've said it at the beginning of this video to say, when you are applying for job roles within the NHS, always read the job specification, always read the the employment criteria, what they are looking for, and always see if you do actually meet the criteria before you waste your own time and other people's time. Because doing this application, guys, it can take a lot. It's been an hour that we've been like talking and going through just one application. So it goes on to say, please include your reasons for applying and take the opportunity to highlight your particular talents and strengths, what you feel you can personally offer, what is unique to you, what sets you apart from your peers. Guys, this is like you showcasing what you have, you marketing yourself, you selling yourself, it's your chance to shine. So on this whole application, this is where you need to like give your all, put your all. But then it doesn't mean that it's difficult. I did it and I got the job, so you can. I do not have a degree in anything. I didn't go to uni, or I don't have much qualifications. I did it, and so can you. So it says, please do not include personal details or duplicate information already provided elsewhere in your application. So I've seen a lot of people do love to say, this is not where you talk about, I'm married, I have children. No, that's not, no, your hobbies, no, not on this one, no. So this is where you're showcasing yourself. This is where you're marketing yourself. This is where you're telling the employer, if you are to employ me, this is what you're going to get. So it's your chance to tell people that don't know you, to give people an idea of who you are, what you're about, and the qualities, the qualifications you have. And these have to be linked to the job role. So one of the reasons why I love to say this is, guys, I always say in my videos, I've got an engineering background, but in this application, nowhere did I mention my engineering background. It's called being relevant to the job role. Maybe one day, if I'm asked of my background and how it can contribute to these roles, maybe I will. But in this case in particular, there is nowhere where I mentioned of my engineering background, because it's not relevant to the job role. So guys, be worried, be aware. Always make sure, if you're going to mention anything, please find a way of linking it to the application or to the job in question. Make sure whatever that you're going to mention is contributing to the question, is answering the questions, it's giving an insight into what you can offer. Not just to mention, because I studied 4 years for engineering, then definitely I have to find someone to factor it in. If it's not relevant, it's not relevant. And it doesn't take away from the fact that you studied that, or you majored in that, or you worked in that industry. Just take to what's relevant in this, regard. So guys, I've got two things. I've got my laptop and I've got like this book. I'm old school, so I do write a lot. And I think I did mention it in one of my videos where I said, when I was back home, back in Africa, and I was applying, I had like a whole book where I wrote like company emails, company names of companies that were recruiting, and every day I would do 50 to 100, guys. So this is where it all started. Before it went on in the computer, this is how I applied. This is how I was writing. This is how I do build my ideas, guys. That's how I take seriously whatever that I do, especially when it concerns growth, career. I do take it seriously like that. I'm not saying do that. Some people can actually like type on the computer and it's seamless, but I do brainstorm. That's what I do before I can put it in. So I will read for you if you see me reading. And so this is like my personal statement, guys. It took me, I don't know, days to write this. So I'll just fill you in on what I wrote, because this one you're allowed to write up to 1,500 words. It says up to, but it doesn't mean like write 1,500 words. If you can sell yourself in 500 words, fair enough. If you can sell yourself in 1,000 words, fair enough. Nobody is holding a gun to your head to say get to 1,500 words. Most people, one of the things that people fear the most when it comes to applying to the NHS is like, where do I get the 1,500 words? That's I don't know, but when I wrote mine, I don't think it did get to 1,500, but I will go through what I wrote in my journal, and then I can read to you the final edit, guys. I'm trying to make it quick, and I'm sure we're nearly at the end, nearly. So this is me in my draft. I had to like fine tune it, but I'll read for you. It says, before applying for this role with the NHS, I read the job specifications and descriptions carefully, checking if I possessed the required qualities, skills, and experience to meet the criteria. I think, you know what, I'll just read the final, and I think if I missed anything, I'm trying to all right, so this was me. I'll read the final one anyway. As I was applying for the role of healthcare assistant with Dash Hospital, I read and understood the job specification and description and checked if I met the criteria, of which I, being with my experience, skills, competencies, and willingness to learn, I believe I can be a valuable addition to the team. This is me selling myself. And always know you are going to join a team, and it's important for you to mention it. And it shows you are aware of the environment that you're going to work in. So I don't know, I'm not saying take my wedding and put it in yours, but stand guided, add yours, add an extra thing to it, and you'll be good to go. So I touched on, I've worked as a healthcare assistant in different care settings such as care homes, hospitals, and private residences, and also respite facilities where I've acquired vast experience. There's no need for you to mention I worked for what. You don't have to be explicit like that. But you can actually say I worked in support work, I worked in domiciliary, I worked in, you know, depending on where you worked, I did live in and things like that. You are allowed to do that, but you don't have to be explicit where you're mentioning company by company. No, I didn't do that. There's no rule of thumb really to say that, because I mean, you've already mentioned them on the top, so there's no need for you to. So I spoke about my experience in different care settings where I mentioned care homes, hospitals, private residences, because I did used to work in domiciliary care. And I said I've acquired vast experience in terms of soft skills and qualifications through education, and as such, I'm quite confident I will be a valuable member within the -- team. You see, I kept on referencing to team. I'm not saying do that, but that's what I felt like is quite important. If you're going to join a hospital, if you're going to, always, it's important also for you to, I said it earlier, to say, go and check the values of that trust, and always be referring. Your answers, let them reference to the values of that trust. Let your answers be guided by the job role as well, the job description, the person specification. It will make you go a long way. I used it and it worked for me. So I went on to say some of the skills I am confident of are. Then I started listing the skills that I thought would be quite, I don't know, would be valuable for this role. So I mentioned something about communication. I talked about active listening, and I spoke about like building of essential professional relationships through trust and confidence, and also to be in a position to articulate relevant factual information and with regards to patients' care and safeguarding as per the organization's policies and procedures. Guys, I do love policies and procedures. I do love them, because I mean, like, that is what should guide you in a workplace. You could be having experience from elsewhere, you could be like without experience, but then what guides us in a workplace is policies and procedures, and it's always important for you to reference that in your answers. I mean, it worked for me, and I do believe like every organization would want somebody to work according to their policy, according to their standards, according to their procedures. So I kept on like mentioning that. And one of the things also that I mentioned was like the issue of patient care, the importance of care plans. I mean, if you're working in care, each and every person has got their care plan, so it's important for you to reference that in your answers. I did it. I'm not saying do it, but do it. Guys, a big welcome to you all, and we are talking, well, we are going through my application. This is the actual application that landed me a role within the NHS. So we are just talking about some of the things that I did as I was applying, and I'm actually trying to make somebody see that there's nothing fancy or scary about a personal statement. Just stand guided by the fact that keep it simple, keep it very factual and relatable, and make sure you are answering the questions in the excuse me, the questions in the job description. And also, one of the things that I feel can be helpful is to make your personal statement relatable to the trust values, the values within the organization you're joining, and also link it to the NHS values as well. If you can do that, then I'm sure you come up with a smashing personal statement. So I went on to say it is through my experience that I've actually honed my competencies around very important areas such as respect, dignity, patience, empathy, compassion, and inclusiveness. Guys, these are qualities of a carer, qualities of the 6 C's of care. So I thought, well, how can I factor them in? And that's how I factored them in. So it's the little things that you do that it can actually like make your personal statement stand out. I spoke about keeping it relatable. I spoke about you making sure that you are answering the job description. I spoke about linking it to the trust values. I spoke about linking it to the NHS values. Now I'm talking about linking them to the 6 C's of care. If you do not get that job, then I don't know. Then definitely we'll need to pray more. But I do feel if you do that, because that's what I did, and I got the job. This is like actually the actual application that I did, and I got the job. So I went on to talk about like the 6 C's of care. So find a way of putting them in within your personal statement. I also said I strongly believe my awareness of the above will help me in my role, so that I deliver quality services through putting the patients first and striving to always better the lives of the people we serve. Putting people first, that's like, you can actually put it across as like offering person-centered care, or offering care that is like focused on the patient and not myself or my beliefs or my feelings or the organization's beliefs and views. So guys, it's important, those things that we are taught when we are being trained, it's important, just find a way to throw them in. Just find a way of factoring them in without like, you know, the exact wording, but just find other words of like bring out the person-centeredness of the care that you deliver. It shows you are aware that you are there for the patient, you're there for the service user, you're there for the, you know, person that you're supporting. So that's how I was approaching this whole thing. And guys, I'll say this, and now I'll hype myself and say I did this on my own, and of course it took me days, guys. For those joining us, this was my draft. I do love to do these things. I do love to show you that like I do put in the work. Excuse my writing, I have got bad writing, but I do brainstorm and it does help. So I went on to say within the last few months, I've managed to go through mandatory training with such and such as part of my bank work assessment and induction. It's important for you to mention that you have been trained, you've done some training. It doesn't matter whether it's online training, whether it's a one-day training. Guys, in this country, they do value training. Whether it's on-the-job training, whether it's online training, it's e-learning, they do value it. Because like it's modern day form of learning. It's modern day form of like on-the-go learning, bringing knowledge to people in a without like that much effort. So do not be shy of mentioning that you've done online training or your e-learning. Mention it, be proud of it, own it. I did it and I got this job. So I'm sure you also can do it. So this is how I factored in the element of training. I said within the last few months, I've managed to go through mandatory training with such and such as part of my bank work assessments and induction. Some of the training was in person and some online. Guys, I'm not lying. This is the application that I actually used. Some of them online, and I believe equipping myself with such knowledge relevant to working in the trust will be beneficial in quickening my adaptation to the role with such and such and such. Since some of the training induction has been completed, and this could set me apart. Do not shy away from saying, because I did training, I believe I'll add value to the team. I'll believe my induction time will be less or whatever. Do it. Say it. Nobody will mark you wrong. Nobody will disqualify based on that. I would rather write it than to leave it out, and then you'll find somebody who was hired based on it. So this is how I applied. This was the application process. This is the actual application process. I'll try to show you so that somebody might just, you know, because the reason why I didn't bring my screen on here is because I do not know whether it's allowed or not. I do not want to end up like, breaching GDPR laws. I do not want. Data protection is very important in this country, so that's why I've been very, very intentional. I've been very, very cautious and careful. But this was my application process for the NHS role. So this is what I did. This is how I wrote it. So I've mentioned training, and that's how I factored it in. So I went on to write about like my soft skills. So this is where I said I am a self-motivated individual and would want to continue my self-development journey through continuous learning and development through the various platforms offered within the trust. This shows you've done your research to say, does this institution offer training? Are they really focused on training and development? And then you are just talking about the things that they say they stand for. I mean, who will not relate with what you're saying if you... Because it's all about being relatable. I would want to, if I was the hiring manager, I would want to hire somebody that's relatable, somebody that's going to fit in so quickly with what we stand for. Instead of just hiring somebody, then I don't know what they stand for. I don't know whether they will like it within this organization or not. So there are certain things that will make you stand out, and part of those things you can only capitalize on them when you do factor in the values of the organization you're applying to into your answers. So this can actually apply even in an interview. Always make it relatable to what the company stands for, what the organization stands for. So guys, for those that are joining us, one of the things that I made sure I was factoring in when I was doing my personal statement was to factor in, to make sure I was answering the questions or answering the job description. Factor in what the job description or person specification says in that job role. Number two, I always made sure I would factor in the values of the trust I was joining in my answers. Number three, I tried by all means to factor in the values of the NHS in my answers. Number four, I incorporated the 6 C's of care. Why I am mentioning the 6 C's of care is because this is a healthcare role. So I had to make sure what I'm writing about myself is relating to the 6 C's of care. That was my approach. You could be having a different approach. It's still okay. I'm not saying that's the best, but that's how I approached this whole thing. One of the things as well was I tried to factor in the importance of training, and that I spoke about in my personal. I spoke about face-to-face training, online training. So do not disqualify yourself and say the only thing I have is online training or one-day training. If you go back to the start of this video, I went through how I answered and said I was writing like 1 day training, 3 days training, and that got me the job. So do not underestimate the power of training, regardless of how long it has been or a few hours. Just put it in. You just never know, because I wrote that in and it got me where I am. So some of the things I incorporated the soft skills, and one of the things that I went on to say in conclusion, I feel that my strength, skills, experience, flexibility and adaptability will be of great benefit to the team and the community we serve. As such, I believe if I am successful in my application, I will proudly represent the -- trust and execute my duties in the most professional and competent manner whilst upholding the trust values. Guys, when we do talk, I always love to say what we think, what we talk about, we become. So from when I was applying for these job roles and everywhere, I've always spoken about professionalism. I've always spoken about competence. I've always spoken about like my strength, skills and experience and things like that. And that hasn't changed. So let's keep on having those conversations around professionalism, competence, and the things that are important. We will become those people. It will get us somewhere. We will eventually become people that talk about excellence, that talk about that talk about professionalism and all the things that we spoke about yesterday. So let's keep the conversation going. Let it be a part of who you are, to say, I'm very professional in what I do, regardless of where I am, regardless of who is watching me. I am professional in my conduct. I do not shy away from showing professionalism in what I do. You just never know where it will take you. So I took the chance and I mentioned it, that I was very professional, that I was very competent, that I was very skilled, that I was flexible, I was adaptable. So a personal statement is that platform where you're selling yourself, that platform where you're telling people, this is who I am. So do your best with it. I'm not saying write what I wrote, but you know yourself, you know your strengths, you know what you stand for, you know what you're about. Go on and maximize on that, and you will go far. So that was it with my personal statement. I don't think that was 1,500 words, guys. It's not. I don't know. I didn't count. So there is questions where it says if you have been in the armed forces or not. I'll not dwell on that. Just answer truthfully. Just answer to the best of your knowledge, best of your ability. Then they went on to, there's the references section. I'll quickly go through it because we are nearly at the end of my application, where it says if you're successful prior to appointment, we will take up as many references as needed to cover all activities, including periods of employment and full-time education that you've undertaken over the past 3 years. So there is some people that will go like, well, I've just come to the UK. I don't know how do I go about references. They want like as far as 3 years references. So you are allowed to use references from back home, references from here. So nothing can stop you from listing those references. So they say any offer will be subject to these being satisfactory. Please ensure that you provide the full contact details for your employer or line managers or course tutors for each activity. So these references, it can be that lecturer of yours that taught you in school. It could be a line manager. It could be current employer. It could be, I did speak about these in one of my videos. Please, guys, be kind enough to take the time to go and watch those videos. I did share on that, so I'll not waste much time on that. They go on to say, please include their work email address. Guys, the importance of a work email address. When they do say work email address, avoid Gmail, avoid Yahoo, avoid Ovi.com. It has to be a work email. We don't want people that will miss out on opportunities because they just didn't take this seriously. So please do make sure, by the time that you apply, definitely have in mind who your references are. By that time, you should be able to know who your references are, which goes on to say the things that we spoke about, like at some point in this video, we spoke about, like, as you are working, wherever you're working, always be competent, professional, be that good person. You just never know when you will need somebody to vouch for you. You don't want to be in that situation where you're going like, oh my God, I can't go to my manager because my reference will not be good. So let's strive to be people of excellence, people of professionalism, people of competence, people of good conduct. People of good conduct, people that do everything to their best. So they will give you a list of, they will say, the character references should be provided by a person of standing in the community, such as, they've got a long list of people that they can actually give you a character reference. They're going to say a teacher, a healthcare professional, which means that person has to be a doctor, a physiotherapist, recent nurse, etc., minister of religion, police officer, solicitors. They say character references should only be used in exceptional circumstances to cover periods of time when you have not been in either employment or education. So guys, let's not just entirely rely on. A big shout out to you, Dr. Mendy. I love Dr. Mendy. She's a big inspiration to what I do. I do love watching her. I followed her. So guys, for those that are here, go and follow Dr. Mendy. My guys, there's valuable things to learn from her. She's released a book. She's a businesswoman. She's she's a lot of things, guys. She's a doctor. I mean, a whole doctor. She's an author. She's a businesswoman. So guys, do take the time to go and follow her. She's also a woman of God, an elder. So if she'll guide you in that area as well. Spirituality, she's big on that. So I do love her. Big shout out to you, Dr. Mendy. Go and follow her. Go and follow her journey. Support her. Buy the book. Guys, get inspired and become. When we talk about excellence, she embodies that. She represents that. I don't know. One of my prayers is I wish I can be like a quarter of the woman that she is when it comes to excellence. A big shout out to you, Dr. Mendy. So that's it about references, guys. Make sure you do have those references. I do see a lot of people do struggle with references. A lot of people will be like, last minute, you're halfway there. You've been accepted. You've maybe gotten somewhere with your employment, or you've passed your interview, and then you do not have like your references lined up, guys. If you're gonna do this successfully, suppose you've done it as best as I did mine, you would want to have your references ready. You don't want last minute to be like looking for references and things like that. No. So by the time that you decide, I'm gonna apply with the NHS, have your references in place. Have your references in place, guys. It's a big shout out to you, Majita Manyora. I do love you. That's my tete there. I do love you. Thank you so much for always supporting. Thank you so much, guys. One of the things that we always should value is when you do have a lovely supporting system, lovely supporting family, treasure them, value them. I do feel supported, and thank you so much, and I do value you. So with the NHS, there and there, you're supposed to list in your references when you're applying. So take these things seriously and have them ready, so you do fill them in. I did fill in my references, all of them in there. That's what I went on to do. After that, there is a section. We're nearly finishing off, guys. V Nails, thank you so much. I do love you. I do love you. Thank you so much for the support. Thank you so much for the love. I'm humbled. They do mention something about equal opportunities. Why I do love to, I'm going to read this, guys. I know we're pressed for time, but I'll read this. Why? Because what inspired today's video is the fact that somebody asked me if I knew somebody that they could pay to do this or to get an opportunity with. Guys, there's fairness, there's transparency, there's equality within the NHS, respectable organization, professional organization. So one of the things that they do stand for is equality. So I'll read. NHS organizations recognize the benefits of having a diverse workforce and therefore welcome applicants from all sections of the community. When they do speak diversity, they do like what basically they're saying is your background does not matter. Where you come from, what nationality you are, what race you are, does not matter. They do embrace everybody from everywhere, from whatever background. So go for it. Do not have anybody telling you, oh no, because you're like that. They will not, guys. This is them writing. It's not me writing, it's them writing. It's on their website. So in addition to this, under the provisions of the Equality Act of 2010, all NHS organizations are required to demonstrate that their recruitment processes are fair and that they are not discriminating against or disadvantaging anyone because of their age, disability, gender reassignment status, marriage, civil partnership status, pregnancy, maternity, race, religion, belief, sex, or sexual orientation. I've had in certain sectors, well, I'm pregnant and then I can't. Just apply for the job. Nobody will ask you whether you're pregnant or not. Nobody will ask you whether you're married or not, whether you're what. They will not ask you. Just apply for the job, showcase your best abilities, give it your all, and we'll see you there. We'll see you there. And guys, for those that are applying, reach out to me, reach out in the comments if we can help each other, guys. One of the things that I love to do when I do have the time is to help you. And one of the things that prompted me to say I will frequently come on this platform, I will make my Facebook page public, was the fact that like we want to reach as many people as we can, help as many people as we can. We are all about growing that healthy community, a community that knows how to support one another, a community that knows how to stand by one another. So basically, it's part of the things that influence me to come over here. It's what drives me to come here nearly every day and speak to people like this, share with people like this, to say, we want to reach so many people. I could just say, well, I'll only share what I know with my friends. I'll only share what I know with my family. But again, guys, we can only become better when we live in a better community. We can only become successful when the community that we come from is successful. So part of that success, let's start starting to be very intentional about our communities, being intentional about fellow countrymen, fellow African people, fellow women. Always think about others. We are blessed to be a blessing to others. So that's why I love sharing. So if you are watching this video, please do share in as many groups as you can, share in as many platforms as you can. And one of the things I love to say is, the fact that we are here, it doesn't mean we know everything. It doesn't mean we're experts in anything or we're good at anything. We are just sharing what we did and where it has gotten us. So this is how I applied for this job. And so I think the other question that will be asked is like equality and diversity monitoring, where you put in your date of birth, your gender, whether you're married or whatever. Then there's a section on disability. Again, this organization will not disqualify you or prejudice you based on disability. So answer it truthfully. They will probably put measures in place to support you. If you have just shown that you're the rightful person for that job, you've got the right skills, you've got the right qualifications, you've got the right experience in it, honestly, they will give you that job and they will support you. Guys, we have seen, I've seen the amount of support that you get there. So when you answer truthfully, you get supported. When you speak out, when you do mention some of these things, you will be supported. They will also ask you, how did you learn of this vacancy? Guys, it's so important for you to be on job search engines, things like Indeed. I do have to say, be there. Be on LinkedIn, be on Indeed, be on Glassdoor, be on all these job search engines. If you're serious about moving abroad, if you're serious about like opportunities, whether you're in the UK or you're in Africa or you're wherever, if you're serious about job opportunities, then definitely you should be having an Indeed account, Glassdoor account, you should be on LinkedIn, you should be having accounts with all these platforms that stand for these things. And one of the things that I love also to say, well, you will declare, and there's also a privacy notice on there. It says your data is being collected by such and such trust, whose privacy notice can be found here. So there's a link to speak on the fact that they will not share this with people that are not involved in the recruitment process or anything. So just know they uphold privacy policies. One of the things that I would want to leave with you or to encourage you as I finish up here is to say, guys, it's actually important for you, if you're going to be successful on this relocation journey, moving abroad journey. Sister Magoroto, I love you so much. Thank you so much for coming. Thank you so much for following. Thank you so much for the love. I do love you, and I do love to hear from you. If you can, please kindly DM me. Kindly DM me, please. So one of the things that I'll leave you with is be intentional with your time, be intentional with your data, your airtime, be intentional with your energy. In this world that is filled with a lot of noise, a lot of everything everywhere, be intentional with who you follow, be intentional with what you consume. What you consume will determine who you will become. What you feed yourself on will determine the results that you get. So guys, I love to say this, to say I am on a journey, a growth journey, and I do appreciate your support. I do appreciate your love. You do love me, and I do feel the love, and I do appreciate the love. Thank you so much. I do strive to to respond to everybody. And guys, if you have any additions, if you feel you've got any questions regarding to moving abroad, life abroad, be it career-wise, family, education, anything, immigration, anything moving abroad, anything life abroad, leave it in the comments, put it in our DM, and when we do have time, we will talk about some of these things. And I do try by all means to come to you nearly on a daily basis, because we cannot go for a day and not talk about these things and not remind each other of what other people are doing to succeed, to get where they are. I always love to say this, to say I am not where I want to be, but I'm not where I used to be yesterday. So each and every day is an opportunity for us to become better, an opportunity to gravitate towards our goals. Guys, thank you so much for the love today. Thank you so much for watching, and thank you so much for spreading the love, spreading the information. I do love you. Keep sharing, keep supporting us. We do love you, and I think that's us for today. I love you, and stay blessed.